It's exciting to be here just to present on this particular initiative that we did with Bayer, and but it's also been very exciting to be in the audience today and just hear all the language that really is music to our ears: patient-centered, patient-first, patient connections, patient support. I don't get to hear that every meeting that I go to, so it's really that's been exciting. Rob is going to talk about the real nuts and bolts of the initiative, Strong at Heart, that we did together as a collaboration with Bayer. I'm going to talk a little bit first, though, just about a little bit about our organization and how this particular initiative helped advance our goals and how we really intersected with the goals of Bayer, our collaborative partner in this particular program. So first, Strong at Heart is an educational initiative launched in February of last year, American Heart Month. It is a women's heart health educational initiative that encourages increased awareness of risk factors, and also is an initiative to actually get women to take action, to start to take preventive measures and reduce their risk factors, including appropriate use of aspirin. And I want to kind of put this in context a little bit for those of you who may not be as immersed in cardiovascular health as I am on a daily basis, just kind of how this health message resonates with overall health messages that are so important to women. I hope that everybody knows that women cardiovascular death is the #1 cause of death of women. Unfortunately, I think people in this room know that, but women at large still are not aware of their risk factors, and that, in fact, more women than men die of heart disease. So that is just like that key overall umbrella message. But as importantly, and unfortunately, the other key thing that our organization focuses on is the actual gender disparities and disparities in care. Women are undertreated. That's the basic kind of simple statement. When it comes to everything as simple as being prescribed an aspirin regimen or something more complex like getting a pacemaker or an internal defibrillator, women don't get evidence-based care. They don't get care that is recommended guidelines, and there's a big gap between the care that men and women get. So that's kind of the overall context of how these specific messages around prevention, and particularly an aspirin regimen, fit into the overall view of women's cardiovascular care today. Our organization, Kevin already mentioned, is the only patient-centered advocacy organization for women with heart disease. That's 8 million women living with heart disease and another 31 million women who are living with at least one major risk factor. That's high cholesterol, hypertension. They run the gamut. Support, education, advocacy, that's what our organization does. But what really makes our organization different is that we are a grassroots, community-based organization made up of patient volunteers around the country. We are more than just an awareness campaign, even though awareness and education is obviously key to what we do. But our organization has grown from its flagship program, which is a training program run in collaboration with Mayo Clinic, where we actually train women patients, women from all around the country who apply to come to a 5-day basic boot camp at Mayo in Rochester, where they get a crash course in the science and medical aspects of heart disease, but also get trained in community education skills, public speaking skills, media trained, and then they go back to their communities to carry both the message of their own personal story and experience with heart disease, which really is a major part of this whole Strong at Heart initiative, and then being able to tie that story to educational messages. We like to say that we're the boots on the ground or the high heels on the ground in the fight against heart disease. So our organization today, just some of the numbers, 27,000 members, 450 of these Women Heart champions working around the country, speaking at everything from something as small as a book club to as large as the Texas Conference on Women. 60 local support groups, still a drop in the bucket, but we're the only national network of in-person, patient-led, peer-led support groups where we train the leaders of these support groups. We also have a new and developing series of other online types of patient support, including obviously a patient community, which is 2,700 members of that, but also some other individual programs, Sister Match, and developing online support groups. Our website gets 100,000 unique visitors monthly, 1 million page views. And we are a key partner of the overall government awareness campaign, which created the red dress symbol, which is called the Heart Truth Campaign. So we joined this initiative as our first foray into social media. We are a small but growing organization and had really not gone into that space, partially because we just hadn't, and partially because we didn't have the resources to do this. So we were looking for a way to empower women to be their own best advocates for heart health. We were pleased to be collaborating, obviously, with a high-quality sponsor in the social media space, and one that was committed to doing some of the same things that we wanted to do. We were looking to expand our reach and visibility among target audiences. Too often we hear, even with the amount of web traffic that we get, that people don't know about us when they want to know about us. Women say they wish they had heard about us 6 months ago, or wish they had known about us when they had had their heart event and were in the hospital. And we were particularly interested in reaching younger women. The good news about heart disease overall is that both for men and women, deaths have leveled off slightly. It's a positive trend, mainly due to new treatments and advances in medical technology. But the only population cohort where heart disease deaths are rising is in women aged 35 to 45. And most of our programs were aimed at women a little bit older. So again, this really fit with something that we had wanted to do. We also had wanted to develop, we're developing and always are developing more online educational content as well as print content. We still are very involved in the print space and will continue to be, because on the whole, on the average, women get heart disease later at an older age. So we have to combine whatever we do in the online or social media space with print content. It has proven to be a meaningful partnership, and Rob will share some of the numbers and some of the exciting things that we were able to do. But most importantly, with a corporate partner and a nonprofit partner like ourselves, there has to be an aligned mission and goals. We both believe, Bayer as well as our organization, in the importance of empowering people, in our instance women, with information so that they can be their own best health advocate. We also created, as part of this, a fund, a premium to really draw traffic to this particular social media campaign. And I think key to this particular initiative, and really everything that we do as an organization, is the compelling messenger. I mean, it is patients speaking about their own experience in an authentic way, that have stories that, our organization was founded on the premise that nothing makes a woman sit up and listen and take action like a woman who has been there, who can tell their own personal story, but has been given the scientific knowledge so that she can educate others. And finally, there was a strong media call to action. As I said, our first entrance into the social media area, we are now working on a much more elaborate plan and next steps. But I think key, and Rob will talk a little bit more about this, is that we've really just scratched the surface with this initiative specifically and the other things that we can do. There's a lot that we have learned. Rob and I were even talking about some of the things that we want to do to continue this and give it even more life. But I'm going to turn it over to Rob to talk more about the specifics.